Before you do this exercise, which is designed to increase range of motion in your shoulders, thoracic spine, and your neck in particular, do a test first. So we're just seeing where your body's at. So just your legs comfortably apart, feet comfortably apart, legs comfortably straight. Turn your head one way versus the other way. Does one way turn more than the other? Just notice. And then where's the tension in one side versus the other? So when I turn this way, I feel the tension here. When I turn this way, I feel it here too. Okay, so just notice that. Shoulders, thumbs out to the side, come up. What happens there? Does it feel hard to do? Is there pain? Is there pinching? And then also come up, palms up, come up this way. What happens there? Is it pinchy? Does it get to a certain point you feel like you really need to bend back? So we're aiming to stay vertical with the body. So this is the stretch of the lats in particular with the palms up. And then from here, your fingers interlocked like you're in a James Bond movie. Your arms stay locked straight. Turn as far as you can. Just notice where that goes. As far as you can, notice where that goes. Is there one side better than the other? And where's the tension? So it's in the right side there, left side in here for me. So just notice where that is. So once you've done the exercise, retest. Even after one set, there's generally quite a change. So this exercise is amazing for releasing this level, so the mid-thoracic spine. So it'll help release the ribs and the thoracic area here, which is pretty much the T8 area, T8, T9, T10 level, which is where the back of the diaphragm connects into the spine. So it's a very, very strong area. So it's tight on pretty much everyone. Releasing it feels amazing, and it seems to have quite a big influence upon the vagal system too, which is a very positive thing. Okay, so just do a before and after test. So have your feet shoulder width, your legs just comfortably straight, your fingers interlocked with your hand like a gun, like in a James Bond movie. Arms stay locked and straight, and you just rotate as far as what you can, and just notice how much twist that is. Notice how much twist this is. Where's the tension in your back, if any, and how far do you turn? Is it really a lot more movement one way compared to the other? Okay, the movement that you turn can turn less of. We start off on that side first. Okay, so if I turn left side is less turn, I lay on my right side, so I'll be promoting that rotation. Okay, and vice versa. Do not do this exercise if you have acute rib pain, and that means, or an acute disc issue. It won't help, it'll make it worse. So that means that if you do a breath in or out, and it causes pain in the back or in the ribs here, do not do this one, it'll make it worse. This is for when your body's not injured. So to set this up, really important, is I've got my knees at 90 degrees to my body, so that it helps the pelvic floor and the diaphragm to be more, so they're facing each other, so there's a better pressurization and linkage with the pelvis and the rib cage. The arm here is on the leg here. As you turn more, you'll find your hip moves. That's natural, that's good, that should happen, but the hip tends to open up. So we keep this down, so you're not letting the legs come apart, so it'll limit how far you go. I've got a block under my head, especially if you have a neck injury, use a block. You can do this by not supporting your head, so you actually train your neck too, so you can do it that way, as long as there's no issue with your neck. Start with a light weight. So I've got about 4 kilos, probably better off to start at maybe about 1 or 2. And the arm is here, and I'm keeping the support here, and I'm drawing back to wherever feels comfortable. So I still have this feeling of connection through here, okay? And then I breathe out through the mouth. So that sound of like you're fogging up a mirror gets the internal oblique to work. And what happens when a lot of people turn here, the rib here opens up. I don't know if you can see that. The rib actually flares out. We don't want this. So we want the breath to bring that in. The muscle draws it in. So I breathe out and push up to the roof. So I'm breathing in, keeping that rib down. So I'm keeping some tension here, and breathe out. So I'm keeping a bit of tension here all the time. Okay, so I'm not letting this be totally loose, so the rib flares out here. And I definitely want that sense of connection through here as I push up. So the serratus is being stretched, the pec, the coracobrachialis muscles, the obliques, the lats to a degree, all the obliques and the intercostals. And you'll find in a very short time, within about 20 reps, and 10 to 20 reps is all you need to do here, that you can touch that elbow to the floor without this peeling off. And it's very deliberate action pushing through to the roof. So I'm not just going to here, I'm pushing right through here. Breathing in, into the nose, out through the mouth. So my elbow goes right to the side. You can play with it going a bit higher than your shoulder or a little bit lower than your shoulder. You can play with the angle. What you can also play with is having your body a bit curved. So there's like a C spine in this, C shape in the spine. And this will affect where this twists more. So it'll affect the rotation a little bit lower. What you can also do is pop a block between your knees, a block or a small ball, a towel, just something to squeeze. So we're doing the exact same thing, but we're keeping the squeeze here so the adductor is being active. So I'm squeezing into the block here through that top leg. And that will change the form and force ratio going through the pelvis closure. If you're someone who feels that you have a rib that sticks out, doesn't quite move properly, you can feel where that is. So when you're on the side here, and when you twist back, you can feel a rib that kind of, if all your ribs should sit level with each other, there's one that sort of sits up, okay? Or it can sit down and two sit up. So for example, if there's a rib that sits up, put your finger on that, right on the rib, fingers, and push into it. So you're pushing into your body and pulling it around somewhat, and you're keeping that pressure there the whole time. So you're helping to mobilize that rib specifically while you do this. And what would be really useful to add to help with the closure in the pelvis is to pop a block between your knees. So you keep this squeeze, especially as you go back, you're squeezing downwards. So you're training that rib and the muscles around it to stretch and move properly. So when it comes to this exercise here, as I do it, I don't want my rib flare to stick out. So I'm not letting it be like this, where the ribs are sticking out. I hope that can come across on the camera. So the ribs are sticking out here. I want it to be with an out breath already. So that comes in. I'm keeping the rib in as I rotate. And I'm breathing out. And then it'll come down more. And what I'm not doing is, as I turn here, letting that connection go, so that it'll give me more range, but it's actually because I've opened up and allowed the ribs to flare here. So I want it to be. So once you've done the exercise, retest. Even after one set, there's generally quite a change. So we've seen what happened. So that's got more rotation, a little bit of tension there still, but more rotation, a lot more rotation and no tension here now. That feels really smooth, palms up, That's way easier. I feel like my body's not going to bend back at all. And then when I do this one, way more turn. So we just created better stretch and opening of the rib cage through the breathing and the movement itself, which opened range of motion in shoulders, thoracic spine and neck without doing any particular type of usual kind of stretching to do that. Reassessment up the same way, so your legs comfortably straight. Interlock the fingers, keep the arms straight. How much rotation? Yep, that's about 20 degrees more, and that's about 30 degrees more on that side. So you're just testing, is there a change? And we want it to be something that's quite obvious change too. So if there is a change for you, which there should be with this exercise, we're doing minimum 2 sets. So 2 sets of 10 to 20 reps, and a third, even fourth set, you'll just find it'll give more and more range. Because we're adding a weight with this, the body learns to hold that range of motion for longer periods. So the thoracic spine here is where most of the rotation needs to come from for the spine. The hip joints themselves should be able to turn as well, which is part of what that exercise is developing too, while there's a linkage with the pelvis and the rib cage. So this is about the infrasternal angle, which is if you follow your ribs up to a point, so it goes to the bottom of your sternum, which is the xiphoid process. If you pop your fingers along the line of the ribs here underneath, like that, it'll give you an angle. So you look at it as if like we're aiming for about a 90-degree angle. That's pretty good, have a 90-degree angle here. So this angle just here. What a lot of people have is where it's a lot more open this side and it's more in on the left. So the angle kind of looks like that. That's very common. This is part of the left AIC pattern. So the right diaphragm is compressed in and the left ribs here are sitting up and out, which reflects pelvic floor that's also not descended. So we're not descended on the diaphragm on this side. We're not descended on the pelvic floor on this side either. So that the body's always in that pattern. So that can become a problem. Where this is really useful is for shoulder function, range of motion, movement, neck range of motion, movement, jaw, and pelvic position. Okay, that's why this area is so important here. It's to do with pressure control coming from the diaphragm. The degree of range of motion is in the shoulders because of that, and in the neck and the jaw, and even a right torsion that goes through the head too, and the pelvis that sits in this position. So the left hip is forward. Okay, so there's a couple of presentations, or a few different presentations that can happen. The 90 degrees is good, and don't often see that. Mine is only 90 degrees because I've trained this like crazy the last 5 years. So what mine used to be was the left AIC, which is drawn in on this side here, and it's open here. So it's got this angle that looks like that. A lot of people, especially if you're deeply into the PEC pattern, it'll be very, very open. So not 90 to be more out here. And what that person looks like is like this. The ribs, you can even see them flaring out here. So mine used to be like this, and they've got a flat back. So they look like they've been told to pull the shoulders back, so they can't get expansion of air in the back of the body, especially the right back of the shoulder here, and the whole left side really. So the body then, it has to breathe by making the body come forward when it breathes here. So the angle is actually quite open. Okay, so this tends to make very, very limited internal rotation, limited neck turn, tight jaw, and that's in especially the neck is in the presence of having no injury in your neck. You just always have this tight neck, or hips that are very limited in the internal rotation in particular this way. Very, very short hamstrings is like, that's all you have. You're most likely in the PEC pattern, and most people, from what I see, about 80 to 90% of people are in the PEC pattern. Okay, so there's a double rib flare. A single rib flare looks like this one's pulled in and this one's open. So I'm just making that happen there. There's a lot of people in this pattern as well. So where these exercises are helpful, it teaches you how to get your rib flares out and down. So when there's a rib flare, so when I'm in here and out this way, these ribs aren't really properly connected into the pressurization of the pelvic floor. The obliques aren't doing a good enough job, especially the internal oblique, to connect to that and pull it in. And what it does, when you connect to the obliques, it creates a shroud around the rib cage. So think about the rib cage, the bones, and there's all this musculature around it. As the muscle contracts, it pulls the bones in a certain shape, And the diaphragm that's on the inside of all that, that is in, when I have this one in, it's sort of domed somewhat. When this one's out, it's more flat. It helps both the diaphragms, especially the left one, to dome more. And even to get a 1 centimeter more domage is massive for everything, for pressurization, for pain, removing pain, nerve issues, range of motion, just feeling less stressed in your body. So we're using the outer musculature, so pretty much all the muscles in this area here, to pull the ribs in and connect them to the pelvis properly. And then as we breathe, the next breath, it makes the diaphragm dome, okay? That's why this is important, what we're doing here. So try this with me. So first of all, just find out what's your diaphragm, what's this infrasternal angle doing? What angle are you? Is it really open? Some people are really narrow, like really, really narrow here. There's different formations of the bones of the ribs and the sternum. For those people that generally have a funnel chest, it's called. So just see what's there. Notice when you're looking at yourself, is there ribs that sort of stick out? It's kind of always sticked out all your life. Do you notice if you stand side on, do you have like a really flat thoracic spine like this? There should be somewhat of a curve through here. It's really flat, it's always been that way. Okay, just notice that. If you've got tight calves all the time, no matter how much you stretch them or do anything, there's always tight calves. It's because the PEC pattern, the breathing mechanism, the way your body's stuck in, is pushing your center of mass forward. So your center of mass and your body weight's always on the balls of your feet. So the calves are constantly active. The calves, hamstrings, glutes, erector spinae muscles are always active. And generally the head starts doing this too, to try to compensate what the pelvis is doing. So getting the rib flare out, redoming the diaphragm in time and usually very, very quickly, it brings this back without you feeling like you're sitting back or like you're leaning forward. It just brings that back, and then gradually over time, the calf tension goes away. So that's why this is important. So do this with me now on your muscle here. So the soft part here, so not on the bone, not up on the ribs here, on the soft part here. So you can sort of push in, okay? So I'm gonna get you first of all to just do a normal breath in through the nose, wherever the breath wants to go. And then all the air out through your mouth. Aim to get all the air out. At a certain point, you'll feel the muscles tighten up here. That's the internal oblique activating, okay, because of the way we're breathing and that sound. Okay, so let's do it again. Breathe in, breathe out. And just everything tight. So you feel everything tight here now. Okay. What I haven't done is done this. I haven't crunched down and used my six-pack abs here. I've stayed straight. So I want you to keep this straight spine. Do one more. Straight spine. Now keep this tension here. Keep the tension exactly how it is. Don't let this expand out at all. Breathe in. So what's just happened is the diaphragm's redomed somewhat already, okay? As long as when you breathed in just then, your body didn't go, do this. So we want to keep that tension in, like you're on the out breath. And I don't know if you can see it, but what happens is the breath inflates everything in the chest. So sideways, frontways, backways, the whole thorax expands out. So 360-degree direction. This is really good. It creates shoulder space. It even creates the angle between here and here. If you're in a PEC pattern, the angle is very, very acute. So like very, very narrow, like this, from the shoulder. As your body expands more, it opens up this way. So it's a bigger angle here, and this is really good for shoulders. Okay, so it creates space in the shoulder. So your range of motion will improve everywhere. Shoulder issues you have start to go away, impingements go away. Because you're able to control what's happening here with the diaphragm. Diaphragm is intimately linked with shoulder range of motion and also neck range of motion too. Okay, so let's do a few breaths. This is really important to get. So let's just let everything be loose. Let the belly come out. Breathe in and breathe out. All the air out. I even feel my pelvic floor being sucked up. Just a matter of that. keep all the air, keep that tightness, and then breathe in. Just notice where it expands. Breathe out. Might be able to get a bit more air out. Breathe in. So when I'm breathing in, I'm not doing this. So this, even all my neck muscles wound up, it's actually still into the body. We're unsafe. There's a threat. Neck tension up here, it triggers panic receptors in the lungs, and it'll make the neck tight, and it'll put the body into a pattern like, so it goes tension on top of tension. So we want it to be a soft, even silent inhale. I'm sort of doing it with sound so you can hear what I'm doing, but silent, soft. So audible exhale, soft inhale. So the neck stays soft and relaxed. And let it go. This will feel very, very uncomfortable and unusual and feels wrong when you first start, especially if you're deeply in a PDC pattern. You'll feel like you can't breathe. You're just teaching the body for the first time how to breathe properly, how to access different parts of the lung space and expand different parts of the rib cage that don't normally expand. It's amazing how much asymmetry is in the rib cage. Some parts are always compressed, others are always too expanded. So we're teaching parts that are compressed to expand and parts that are always expanded to actually compress. Really important. So the body should be able to compress, expand, compress, expand. That's what the gait cycle should do. There should be some parts that compress or another part expands, that compresses while this expands. Different things happen. So it should be like a zigzag network through the body. This compress, this expand. When you go the other side, when you step through the other leg, it should do the opposite. Okay, that's ideal. Okay. So if you let me look at me from the back here, I'll try to make it more obvious. You'll see the back expand. And I'm definitely not letting the shoulders lift up.